How's it going, guys? So this is a very high yield presentation for USMLE, one of the most underrated diagnoses because despite it being so high yield, students often don't know much about it, okay? I will tell you exactly what you need to know to increase your score. Very valuable question here. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. And find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Links are down below. Now, we've got this 6-year-old boy, one-day history of diffuse abdo pain. Last week, he stayed home from school for a day because he wasn't feeling well. Temperature 103 Fahrenheit. Physical exam shows abdominal fluid wave, mild ankle edema and periorbital edema. IV fluids are administered. Questions asking for the most appropriate next step in diagnosis for his acute condition. Now, he stayed home from school for a day because he wasn't feeling well. That's the USMLE's way of telling you he's had a recent viral infection. When you combine recent viral infection in pediatrics with ascites, and periorbital and pedal edema, that sounds like minimal change disease, okay? It's a very common nephrotic syndrome, losing protein in the urine. That's going to decrease intravascular oncotic pressure, allow for transudation. That's why he's got all this fluid here. Normally treated with steroids, and we do a biopsy to diagnose that. In this case, biopsy is the wrong fucking answer, but we would do biopsy to show no changes under light microscopy, as well as a podocytic effacement on electron microscopy. You say, well, why is that wrong if this is minimal change disease? It's because we're asking for the patient's acute condition. Okay, so he's got diffuse abdo pain with a fever. That's spontaneous bacterial peritonitis, okay, SBP. I said very underrated diagnoses because students are like, SBP, that's like, haven't heard of that before, okay? Very important diagnosis. And I've observed that this shows up 3 main ways in NBME vignettes. The first is this, someone with nephrotic syndrome, okay? This shows up on the new PEDS form as a kid with minimal change disease and a fluid way with a fever. It also shows up as a patient who has cirrhosis. Okay, that makes sense. That increases the risk for ascites. So they're going to say hemochromatosis or Hep B, Hep C, or alcoholism with fever and a fluid wave and a diffusely painful / tender abdomen. And they can also tell you a patient who has renal failure who's undergoing peritoneal dialysis, okay, often a diabetic, for instance. So this is SBP. And what we're going to do to diagnose this acute condition is a paracentesis. This is not the same thing as pericardiocentesis. Paracentesis means aspiration of fluid from the peritoneal cavity. And we're going to do a gram stain of the fluid, a culture, as well as looking for greater than 250 white cells per high powered field. And we're going to treat with ceftriaxone. Very fucking important for USMLE. Okay, I've seen questions where they'll throw paracentesis in for a cardiac question, and students think that's pericardiocentesis. It's not, okay? So that's an important word you need to know. Ultrasound, wrong fucking answer. We're not looking for anything specific here that we would see on an ultrasound. As I said, biopsy for the underlying minimal change disease, but a paracentesis for the SBP. The CT answers are wrong. I mean, obviously, you think we don't want to do CT in a kid anyway, so it's like, ooh, wow, like, would we consider with contrast, without? There's no reason we would want to do a CT in a kid, okay? Very fucking rare we do CT in a kid. There's one question on one of the newer PEDS forms where they mention blunt trauma to the abdomen, and the answer is CT, okay? As I said, very rare. We don't want to give radiation to kids, but there is one question on new PEDS form, blunt trauma to the abdomen, where they did a CT scan. Ultrasound in a kid would be for things like Wilms tumor, okay? So that's your take home for this question. SBP, spontaneous bacterial peritonitis, do a paracentesis, very fucking high yield. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.